Happy Wednesday, everyone. Thank you for stopping by our health and wellness blog. And I'm going to get right to it. Of course, during the course of this COVID-19 crisis, we all have a heightened sense of awareness of the symptoms of COVID-19. And with it being the end of flu season and the start of allergy season, there are lots of symptoms that overlap. In fact, you could be in the grocery store and you are aware of the person who coughs 3 aisles down and may think to yourself, oh no, does that person potentially have COVID-19? Whereas months ago, or even, at the beginning of flu season, we would have attributed to they're maybe a little bit under the weather, they have a cold, maybe they have asthma. But now I'm sure that all of us are a little bit more aware of when someone coughs or if someone says they have a fever. And even within our own household, a fever, a cough, a runny nose means something a little bit different than it did several weeks or even months ago. Today is really just to give you the information side by side, just to compare and to discuss and talk about, because the fact is sometimes it's hard to differentiate between the symptoms and when to be worried and when not to. And then just to make sure that you're informed about what the symptoms are, how it's spread, and then ways to treat each one. There is a great graphic that's associated with the blog that I encourage you to take a look at. It just puts them side by side so that it's easy to look at, easy to read, and feel free to share with other family members or other people in your community, because I'm sure we all have the same questions and worry about the same things when it comes to the symptoms of all three, which can look very much alike. So I'll jump right in for a few moments. So let's start by talking about COVID-19. So the classic symptoms: fever, cough, and shortness of breath. And if you look over to the flu column, you'll also see that some of those same symptoms, fever, chills, cough, shortness of breath, can certainly occur, especially if you have underlying respiratory issues. And then there are other added things with the flu, with the muscle aches, the body aches, even with the sore throat. But it can look very similar, especially during this time of flu season, respiratory season, and then the common cold. With allergies, it's more of the itchy, runny nose, sneezing. There could be coughing as well. Classic with allergies is the hypersensitivity with the skin, whether it's rashes, swelling, and then people who have severe allergies can have shortness of breath, the coughing, the wheezing, and chest tightness, especially if they have underlying lung disease, whether it be asthma. But all of those things can be exacerbated during allergy season. The one thing to note: allergies are not spread. They're not spread from person to person. And usually there's no fever associated with it. Fever indicates some type of infectious process going on, or whether it be a virus or a bacterial process. But in allergies, there is no fever associated with that. In terms of prevention, so with COVID-19 and with the flu, the standard of practice is to be practicing good hand washing. So good hand hygiene, good respiratory hygiene, meaning when you cough, you sneeze, that you are covering your mouth and nose, that you're disposing of your tissues properly. And it's best that if you are sick with either one of those, to stay away from other people, because it is spread through droplets and close contact with others. With allergies, one key factor is to know what your triggers are. So whether it's environmental allergies or with the changes in season, those types of things, knowing what triggers those allergic responses will actually help in preventing those from happening, whether it's taking an antihistamine or staying away from whatever your trigger is will help, especially during a time when we're changing of seasons, just so you can rule out that, oh, it's not my allergies, it may be something else, so that you can get it checked out. As far as treatment, so right now for COVID-19, you would have to isolate yourself. And then the rest of it is symptom management. So most people are able to stay at home and will recover from the COVID-19 illness, but certainly they want to stay away from others and quarantine themselves. in terms of the flu, there are antiviral drugs that may be an option depending on where you are within your illness that can help decrease the symptoms that you're having. And once again, to stay home and rest is what's recommended. And then for allergies, the things that you can do proactively is to be sure to take your antihistamines. And it doesn't have to be, the first time that you sneeze or cough, you're like, oh, I need to take them, but rather to be proactive about it. When the seasons start to change with daylight savings time, it's a great reminder that the seasons are changing and maybe I need to reach out to my provider about my allergy medication or starting my allergy medication so that it's already in your system so that when the flowers bloom for the first time, that you're not having an all-out allergy attack from that. And then if you take allergy shots, allergy tablets, or if you do nasal sprays, all of those things will help to decrease your likelihood of having the symptoms, especially during this time when it's hard to differentiate between what's an asthmatic cough, what's an allergy cough, or is this something more? So that just gives you some idea and a comparison side by side of COVID-19 allergies and the flu. Of course, if you're not feeling well and you have any of those symptoms, please call your medical provider to get more guidance. Certainly, if they feel that you need to be tested, please take that seriously because during this time it is very difficult to differentiate between what may be COVID-19, what may be flu, unless you're really going to get tested. So if you're at all concerned about that, please call your medical provider first for further instructions and then adhere to whatever those instructions are so that you can be tested and be treated adequately. Thank you so much and take care. Have a great week and I'll see you next time. Thank you. Bye-bye.